Hello, linguists. Welcome to another episode 43, if I'm not mistaken. I'm so happy that we have this very special guest, as usual. We try to have special guests every single time in every single episode. So this time we invited Miss Kelly, and you're going to have to help me out, Kelly, because I forgot to ask you how to pronounce your last name.
It's Grzech, so that's my maiden name.
Okay, Grzech. Okay, that's way easier than I anticipated. But
it's the American pronunciation.
Yeah,
I couldn't tell you the Polish pronunciation.
Go ahead. Yes, please.
Oh, I can't.
Oh, you can't.
The Polish pronunciation. If it were in Spanish, I could do it.
Right. I was because we have a social media team. I have a social media team, which, by the way, hello, Gonzalo and Sandra. You're amazing. Thank you so much. I know that things get out of control mainly because of my schedule. So I just want to thank you. You're doing so awesome. Gracias, chicos, de verdad. No, ustedes son mi mano derecha. Okay, so please let us know if you're watching us. Where are you watching us from? As usual, how has your week been? I had a really big milestone yesterday. I'm gonna share it with you next week, I think. Yeah, I'm gonna leave you there hanging for a little bit because I want to pass to our guest and ask her how is she doing? How have you been?
I have been very busy, incredibly busy, which I'm sure is something that we can both relate on. And I did just want to say thank you so much for having me on your program today.
You're welcome. You know what, Ernesto Jimenez, who is a very faithful follower of the linguists, suggested to invite you. So I am very happy that you're here with us to share a lot of information. Here, look, we already left that on the band here. So I'm gonna hide it for a little bit so you can see Kelly's name. And we're gonna go a little bit into Kelly's biography first. For those of you who don't know her, Kelly is a medical interpreter. And Kelly, you want to tell us a little bit about your background?
So I am a medical interpreter. I'm a certified medical interpreter through the NBCMI. And I actually studied interpretation and translation at Virginia Commonwealth University. I went through this program called the SETI program, which is the Spanish, English Translation and Interpretation program. I've been interpreting since, I believe, 2016. So I'm relatively new to the field, but I'm very, very happy to be in it. And I'm very passionate about it and very excited about it. And I've been doing a lot of mental health interpreting, had a brief break. Thank you, COVID. But fortunately, yesterday I actually started back interpreting again for mental health. So I'm super excited about that.
Yeah. And you are born and raised in the United States.
Yeah.
So this is, I have to say, I'm going to throw Ernesto under the bus. And this is one of the questions that he has. And I'm sure that many other interpreters have asked you this. So this is like a curiosity that everybody has. Why and how? Because I haven't heard you yet, but I heard that your Spanish is impeccable. So first of all, I guess my question would be, what gave you that little spark to want to study interpretation?
Ooh, that's a long question. It's a long story. I'll try and make it because I know we have so many things to cover. Brief and as interesting as possible. I used to work in food service, actually, and I worked with a lot of Spanish speakers. And I did take Spanish in high school, but you know how it is. You take a language in high school and it just doesn't stick. And I started working in restaurants with a lot of folks from Central America, Guatemala, Honduras, El Salvador. And I ended up kind of picking it up. I ended up being a catering coordinator at a pizza place. And I was kind of the contact person, the go-to person. Okay, well, can you communicate with the kitchen? And slowly but surely, I actually ended up in the hospital in 2011. I had a near-death experience. And just after I got out of the hospital, I didn't really have a lot of support. And the amount of support that I was given by the Hispanic community was just overwhelming. And that kind of sparked my love for the community. And I decided, okay, I want to do something. I want to become a Spanish-speaking social worker. And then when I was in college, I majored in Spanish. Because my grammar wasn't that great, I tested into about 200 level Spanish. I would speak Spanish, but my grammar wasn't that great. And I was told I could declare social work as my major in my junior year. Junior year came, they said, you can't double major with social work. And I said, I can't leave my Spanish behind. Remembering my dream, I want to be a Spanish-speaking social worker. So I was a major in Spanish. Then I decided, okay, well, I'll just come back for my MSW. I'll just go into the SETI program I heard about, which is all about Spanish, English, translation, and interpretation. Went into it, and it turns out I absolutely loved interpretation. And the very first time I interpreted in a medical clinic, I mean, I was hooked. I was like, this is for me. And now 4 years, oh my goodness, more than 4 years later, here I am, and I'm still doing it, and I'm still loving it, and I'm not going back for my MSW because now I'm like, I can't imagine doing any more school. So
that's cool. That is awesome. I like that. Yeah, I mean, Spanish, this is something that I've heard from a lot of colleagues that, for instance, are taking the federal exam. And they say that, and these are people who have been born and raised in Hispanic countries, Latin American countries. Hello, Alex Mendez from Long Beach. That they fail the Spanish part, which, and I'm not saying these are well-educated colleagues, that have gone through majors and probably masters, and yeah, a lot of them have told me that. And interestingly enough, the Americans that take the federal exam pass it because I guess they put more effort into it. We kind of just trust our ability of native Spanish speakers, but Spanish can be really hard, especially with all the tenses that we
Oh my goodness, there's like 46 or 48 different conjugations of each verb. Excuse me for not remembering exactly how many.
But now, how do you feel? Or do you feel more confident with the grammar and all that? Like, did it take you to a different place once you took that SETI program?
Oh my God. The Spanish program brought me here. And the SETI program, I cannot say enough amazing things about the program. Unfortunately, though, I'm hearing from a lot of folks that especially during the pandemic, a lot of the resources are being diverted away from the humanities, including the language programs. So that's unfortunate because, I mean, especially you think about Americans, we generally don't learn anything other than English. And this is something we already place so little value on. And then to kind of push it further in that direction is just really unfortunate.
It is. I actually do want to start something. I've been talking to some colleagues about starting something here because I think that the best way to go about it is to go to high schools and let the kids, the ones that are about to graduate, you know what? If you really put your effort into this, Spanish, French, whatever, you could, 1, make a good living, and 2, help a lot of people. And it's such an interesting career. Like, you don't only get to know the language and the people, you get to, well, certainly most people get to travel, but you get to travel in your mind because you have to know the culture so well to be a good interpreter. And yeah, it's just fascinating. I think that all of us love it. And like Gustavo Negrete is watching us. Where are you watching us from, Gustavo? You didn't tell us. And then Lai Lukum, he's from Guatemala, and he's a Quechua and Quiche interpreter. Thank you so much for liking the lives. Please forgive me because I probably am mispronouncing your name, but I love that. I hope that we can have more interpreters from Quiche, Quechua, and all of the other languages that we have in Latin America. So Kelly, you said that you started working in the in the medical institutions, and you got hooked. And then I think there was something about mental health that you found really interesting.
So of course I've always been very interested in anything related to mental health. Oh, thank you, Nanji. Nanji is my cohort. She is the founder of Interpremed. So,
Mhm.
Nanji, sorry. Um, so, mental health interpreting has been something really interesting to me because of my interest in social work, which social work and mental health, they kind of overlap a little bit. And then I came to discover I was really blindsided because medical interpreters are very often called for mental health interpretation because you have psychiatric departments in hospitals, you have standalone mental health facilities, mental health clinics, and they often use medical interpreters as well. So you have interpreters who might not necessarily be well versed in simultaneous interpretation, which in my personal and professional opinion, is absolutely necessary for mental health interpretation, being called to interpret for mental health scenarios. And so I started to notice that, well, first off, I was blindsided, even as someone who I was trained by a federally certified legal interpreter. So I do have a background in simultaneous interpretation and a background in mental health. And even then, I felt I was blindsided by mental health interpretation. So it was very overwhelming to me. So I couldn't imagine how the rest of my colleagues felt going into these sorts of situations.
I see. I'm so sorry if you're hearing. Can you guys hear anything? Yep. Okay. I'm sorry. It's my. I have 3 kids, as many of you may know, and they tend to be a little loud at this time. So I apologize. But I agree with the simultaneous. I remember when once I was sent to interpret, I didn't get to do it because it was canceled, but I went to the hospital and I was ready and I was very nervous because I had never had an experience with interpreting for patients with psychiatric problems. And so I remember I asked, could I interpret simultaneously? And the person that was there told me, we prefer not to because they might think that they are hearing voices. I assume that this was a schizophrenic patient, maybe, I don't know. But yeah, and so I've thought about that, but I do agree because it would the whole transition would be much better. The transferring of information would be much easier. But what has been your experience then when interpreting consecutively with this kind of patients?
It's difficult. It does depend. It's on a patient by patient basis, certainly. Especially if you're working with a psychiatrist. Psychiatrists, working with them tends to be very medical. I mean, after all, they are typically MDs or DOs, so they're going to have that medical background. So everything's going to be very medical, and you're going to be talking about dosages of medications and things like that. They can provide therapy, but generally, that's going to be more your consecutive assignments. However, if a patient is going on an emotionally charged rant or has an emotionally charged utterance, what's the likelihood that you're going to be able to stop them and say, hey, excuse me, can you put your emotions on hold for a moment so I can interpret consecutively? It's just not realistic in a lot of instances. And then when you get to inpatient psychiatry or psychology, mental health in general, a lot of times these are group settings where you have group therapy and you have group settings where you have 5, 6, 7 different patients and they're all sharing their stories, overlapping over each other. Consecutive just really, in my personal and professional opinion, isn't ideal for that. And so part of the difficulty is knowing when to switch from simultaneous to consecutive and back, and knowing your limits in note taking, knowing your limits in simultaneous, and knowing your limits in consecutive. So it's really about knowing yourself and being well versed in all these different tools, all these different interpreting tools.
Well, the other thing I'm wondering, you cannot do team interpreting in medical.
I have been offered one assignment where it was supposed to be teams, and we were actually going to use this was actually my first time being offered equipment for simultaneous. And unfortunately, the assignment never took place, as that often happens. but it's very rare, especially when you're requesting through these. I'm an independent contractor, so a lot of the agencies that I interpret with are medical, specifically interpreting agencies. So going through those agencies, they're really not going to be equipped for simultaneous interpreting and team interpreting.
Which is it's a shame, because I think that if you're going to be an agency and dedicate yourself to this, you should at least know a little bit about this. And the other thing that I was going to ask you is if shadowing is allowed, because that would be very, very beneficial for whoever is coming, right? To learn that transition between simultaneous and consecutive that you're talking about. You only get that with practice.
Yeah, and it's so difficult because, especially when you're doing inpatient,
because of the HIPAA rights and
exactly.
things like that.
And
Right?
also too, not to say that, mental health interpreting is inherently more dangerous than other types of interpreting, though in a poll that I did that is on my website, I did find that that was generally a perception that interpreters had. There can be some safety issues, especially if you're going to an acute unit where you have patients who have more advanced psychiatric or psychological disorders, where having someone else with you it's just not going to be safe, and it's not really conducive to the therapeutic environment either.
That is, yeah, now that you say that, I remember some of the comments were negative, to put it plainly. Again, I never got to experience any actual medical interpretation in a psychiatric facility, but once that was canceled, I asked, and the comments were negatives. But I always wondered, how would it have been if I would have done it? It probably wouldn't have been so bad.
And I love mental health interpreting. I think I already mentioned to you that yesterday I actually went for the first time to interpret for a mental health interpreting assignment in a year since the pandemic. Last year was the last time I interpreted in an environment like that. And it was just, I felt energized afterwards because it's one of those things that I'm very passionate about. And I know I was able to give the very best service I possibly could to both the parent and the patient in this instance, and to the provider. So I love mental health interpreting. It can be difficult, but sometimes when you have more lows, you also have more highs, and it kind of evens out.
And one thing that you promote is the fact that we, as interpreters, or as medical interpreters, I should say, we should be specifically trained in mental health interpreting. I have seen actually other colleagues that are backing you up on this. Why? I know it probably has to do with the terminology, but why else do you think?
So it does have to do with the terminology, definitely. It also has to do with the fact that what I mentioned previously about not just using consecutive mode, even the Certification Commission for Healthcare Interpreters, their exam includes a simultaneous portion. But what's the likelihood, if you're just a medical interpreter, that you're going to stay fresh on those skills? I have to purposefully go out of my way to practice my simultaneous if I'm not actively engaging in mental health interpreting. So those skills get rusty. It's like a muscle. You lose it over time. The tone goes down with time. And another thing too is just having a background knowledge of just the mental health field in general. Knowing things like trauma-informed care is incredibly important, because the way that you conduct yourself can have a huge impact on the encounter. Your tone of voice, your body language, the way that you interpret things. If a provider is using, let's say, gender-affirming language, you want to mirror that in your interpretations. If a provider is going out of their way to avoid ableist language or rephrasing something in a particular way, you have to rephrase it in that particular way as well, which I don't feel like medical is just a completely different field. It's more, okay, I want to know what your symptoms are. It's very formulaic. It's very, let's cut to the chase. Whereas mental health is more qualitative, more, okay, we don't know what's relevant. Let's hear everything first, and then from there, we'll kind of distill that down.
That is, and what I'm thinking is that probably emotions in patients, right, are weigh on your skin at that moment. Like you are well, as the patient probably, I don't know, correct me if I'm wrong, but I'm assuming that the patients are wearing their emotions on their sleeve, as they say. So you really have to be careful, as you're saying, with the way you conduct yourself, because anything might be taken in the wrong way, and they might either feel offended or scared or threatened or whatnot. Is this why you're saying that?
And it can depend on the patient, certainly, but especially with any patient. So you're going to have a spectrum. You're going to have your patients who just have depression, are dealing with a difficult event in their life. And then on the other end of the spectrum, you're going to have patients who their perception of reality is altered. And in those cases, I would say it's far more important to be aware of your tone, of your body language, all of those things. I'm not saying that it's not important in those other situations, but you never really know. I mean, how would you feel if you were talking to your therapist and there was someone across the room sitting there with their arms crossed, looking down at you like this? It wouldn't make you feel very good either. And it's supposed to be a nurturing kind of supportive environment, and you want to support that as much as possible as an interpreter.
I see. I get what you're saying. I think what I'm hearing is that the etiquette varies when it comes to interpreting in that scenario. Very interesting. And so, do you want to promote this? You really want to focus on interpreters having more training on this? Do you offer or have created anything that might be available for our followers?
Gee, it's so nice of you to ask. So on that webpage that I shared I believe I shared it with you. It's my website, kghinterpretation.com. There is a link up at the top that's called resources. And then if you go down, there's mental health interpreting resources. There it is. And on that page, you'll actually see a link to some trainings that I have produced. American Against Language Barriers, which is a nonprofit organization, has actually picked up these trainings. I'm working with them to produce a 10-part series on mental health interpreting for medical interpreters. Both of the first 2 parts of the series are out right now. Part 3 is coming out soon. But this is a series of trainings that is specifically tailored towards medical interpreters who want to interpret in mental health settings. And they're actually free to view, so you don't have to pay anything to see them. If you would like CEUs for these courses, yes, there is, of course, a nominal fee for that. But I am so incredibly ecstatic that they're free, because there are so many CEU courses out there for mental health, but not all of them are free. And a lot of them focus on interpreter mental health, and most of them focus on vicarious trauma. And I think interpreters need a little bit more training, medical interpreters, in terms of mental health training, because it's just not really widely available. Even in the program that I went through, I feel like it was very little training on mental health interpretation, but all of the skills that I received, that I learned about, like simultaneous interpreting, note-taking, consecutive interpreting, all of those ultimately helped me with mental health interpreting. So there's a lack of training, which I'm so incredibly grateful that it's available on Americans Against Language Barriers. And also there's a lack of self-care resources for interpreters.
So and you have that too.
Yes.
Tell us about that.
Yeah, so I shared a link with you of self-care resources. So,
oops, sorry. That's not it. There we go.
So my self-care page, it contains, I try and update this as often as possible. If I find a new resource, I put it there. So I actually have a group called Interpreter and Translator Peer Support Group. And I wanted to create a space where interpreters could talk about kind of mental health issues and self-care, just kind of general, how do you feel? How are you feeling this week? What are your goals for this week? Versus a lot of these other professional groups that focus on skill building, more like hard skills versus soft skills. And soft skills are so important in mental health interpreting, like developing your emotional intelligence, developing your active listening skills, things like that. And unfortunately, during the pandemic, I was finding that a lot of interpreters were really just, they were struggling. I was one of them. I was struggling too. And I'm a moderator of and administrator of a lot of Facebook groups for interpreters. And a lot of folks came to me because I was, I guess, I was a moderator in the group or the administrator in the group. And I can't even quantify how many interpreters I talked to. And I even had one interpreter, unfortunately, threaten to take her own life over Facebook, and I had to go through the whole reporting process, and something that obviously I was not trained to handle, but I tried to handle it the very best I could. It came up very unexpectedly. So interpreters are crying out. Interpreters are still crying out. And there's just really this lack of resources out there for us, because we do handle a lot of really tough things and there aren't a lot of outlets for us. And mental health care in the United States is not accessible at all, unfortunately.
And now that you say that, I'm wondering, because I have worked in the medical interpreting field, but I prefer personally court interpreting. But we also have vicarious trauma. So I'm wondering if these kind of groups would also help court interpreters that have to, work in those conditions.
So the group is open. It's called Interpreter and Translator Peer Support Group.
Mm-hmm.
And it's not specific to medical interpreters.
Okay.
We have conference interpreters, court interpreters, social service interpreters, mental health interpreters, and translators. Because I was thinking, I don't want to leave out the translators, not just because I want to be inclusive, but also because I think we have a lot to learn from our colleagues, especially during this time of COVID-19, where a lot of people are shut up in their houses, and we have those stereotypes of translators. Okay, they often work from home, from their offices. Maybe they have some strategies for, spending a long time working at home. Okay, well, I'm sitting in my chair in my office all day. How can I work on my back pain? Because all those things are self-care too. So interdisciplinary kind of sharing, advice and things like that. So
I like that. Okay, awesome. That's great. So we have Laura, Gabby. Gustavo said that he was watching us from Costa Mesa, California, and then Gabby is watching us from Mexico, and Laura from California. So hello. Let us know if you have any questions for Kelly. And yeah, just put them in the comments, and we will show them. We will ask the questions. If you are interested in becoming a medical interpreter or a mental health medical interpreter, which is something that you have to have a special soft skills, certainly. So yeah, that's very interesting to know. One thing that I wanted to touch on was the fact that you mentioned, I always kind of try to have a little bit of a side, I guess. And you mentioned pediatric mental health. So tell us about that. What you've I remember you told me that you think it's going to be something big in the coming years. As a mother, I totally see that. Not for my kids, fortunately, but I see a lot of other kids that are probably going to struggle in that area. So tell me a little bit about that.
So I think with COVID-19, just in my personal experience interpreting, I really only stopped interpreting in person for a month or two at the beginning of the pandemic, and then I just hit the ground running. And I've been doing a lot of pediatric interpreting, especially in terms of developmental pediatrics. So a lot of what we call neurodivergent children. So children who are autistic, children with ADHD, anything along those lines. And what's happening is, and also pediatric mental health, I think, is going to be another big thing. Because children are creatures of habit. I have a 10-year-old stepson myself, and I always tell my husband, it's important for children to have structure, right? And so what we're seeing now is we're seeing this lack of socialization as a result of schools closing, as a result of everything taking place over Zoom now. And really kids aren't really going out and playing with each other. So a lot of times these kids aren't developing their social skills, or they're having mental health issues that are becoming worse as a result of the pandemic. And as a result of their whole lives basically just changing right before their eyes, and having to struggle with a lot of things that having to explain them to a 5-year-old or even a 10-year-old can be really difficult. So that lack of socialization, that can cause some difficulties, and then also it can cause some mental health difficulties in addition to developmental difficulties. So I
Yes.
think we are going to be seeing kind of an influx, this rise in, after the pandemic, after things start to normalize a little bit, we're going to start seeing more and more of these children seeking out services. Because I know myself as a parent, I always put my stepson first. And what's going to happen is, first we're going to have the kids. We need to get the kids taken care of. And so the kids are going to be the first priority. And then slowly but surely, as the kids are okay, all right, well, now it's time for the adults to put themselves first. So kids, then adults. That's just my kind of premonition of how things are going to play out.
Yeah. Yeah. I agree with you in that this whole catastrophe has had a very negative impact on kids. I do have a probably very unpopular personal opinion that I'm not going to share, but I agree. There are going to, I mean, I already see it. I know kids personally that are taking, which I found completely devastating, honestly, taking antidepressives, and they are like 11 or 12. And it's just, again, not my way of managing those kind of things, but I totally understand.
Listen, I'll be
It
quite
is.
honest with you. I started on antidepressants when I was rather young, and I believe that there is certainly a time and a place for such medications, but I think particularly in my case, it might have been a little too early for me. Um, it's difficult. It's difficult, and
It is.
unfortunately, when you're a child, you don't have a lot of say in situations like that.
Yes, yes, certainly. And I think that the what we need to I guess highlight is the fact that it's happening and it's
Oh
there.
yeah.
And then we need, as interpreters and as translators, we need to be prepared for this, and probably have a special training for this as well. Because one thing I'll tell you as an interpreter in court, one thing is to deal with cases with adults, and a whole different ball game is interpreting for kids, which is something that I just had to put my heart of steel and show zero emotions, because I have 3 kids, and I just, they are my life. So I always tend to see them in other kids, just like I think it's just natural. So yeah, just get more training probably, and be prepared for what is coming. We have a question.
Yes.
First, we have a comment from Laura. She says medical interpretation is very mentally demanding, remote even more so, especially during family meetings. Yes. Oh, yes. This is just it's just the way it is, and you just have to ride the wave as it comes. Be a good surfer, do the best you can, and I do want to leave that out there. We are stronger than we think. We can take care of things ourselves, even though a lot of times it doesn't seem like it.
And
Yeah,
I'll
but
say that's something that I found really important for me, especially during these trying times, is, sorry, I was just kind of looking at the comments on the side, is looking back to experiences in which you've interpreted for really difficult situations and how you got through it. And I like to think back on that when I'm going through tough times is, hey, I interpreted for this really incredibly difficult situation, but I did it, and I can do this too.
yeah, I like that. I like that a lot. So Gustavo Negrete has another question, and is, I would like to know what Kelly's take is on the training of interpreters in management of assaultive behavior or crisis prevention intervention, primarily for the purpose of being able to identify both verbal and nonverbal cues during psychiatric encounter, both from the patient, client, and the provider? Good question.
That is an excellent question.
Yes.
Love that question, because in part 3 of the mental health, actually, I'm so sorry. It's actually in part 2. At the end of part 2 of the mental health interpreting trainings, that you'll find at the link there on the bottom, a link to those trainings there. At the end, I get into interpreter safety, especially in inpatient settings, especially in inpatient acute settings, where I will say firsthand, and I'm not saying this to scare anyone away from mental health interpreting, because as I said, it's incredibly rewarding, but I have been assaulted by a patient in a mental health facility. There's definitely some warning signs, and I only learned about them after it took.
Right. Makes sense.
And there's an acronym. My goodness, I cannot think of the acronym. But at the end of that training, I actually do get into some signs and signals that, okay, we might be on the verge of a breakout here. What can you do as an interpreter? Can you dismiss yourself from an assignment if you feel like you're in danger? Absolutely. Because I think this is something that we're taught to advocate for the patient, but we're never taught to advocate for ourselves. Now, mind you, that's not entailed within the advocate role, because, of course, we have the 4 roles of the medical interpreter, and the very last most involved role is the advocate. But part of self-care is advocating for yourself, and part of mental health interpreting is self-care, and part of medical interpreting too. So if you do ever at any point feel in danger, distance yourself, certainly. And also, if you feel like you're in an unsafe environment, there's no obligation for you to stay there. Any agency, any facility that would require you to stay in a situation where you felt you were in danger, my personal philosophy is that's not acceptable. You should not have to be in a situation like that. They can use a telephonic interpreter. They can use a video remote interpreter. You do not have to physically be there and put yourself in harm's way. So I have interpreted for patients before who have been, who have had those kind of behaviors, and it's not easy.
Right.
But,
that's good. I really like the advice that you're giving, because I think that we have to remind ourselves of that every single day. You have the choice, especially if you're feeling endangered, to step back, talk to the provider, the nurse, whoever you're with, and tell them that you are not feeling safe, and walk out of the room if you're in a room, or the, I don't know, usually this happens in big rooms, right? So then we have another, Laura, I shared the link where you can find the resources, is the one that I'm sharing right here. So thank you so much for that question. It was Gustavo. I really appreciate it. And they are just giving you a lot of congratulations. She says that she belongs to the Facebook group IT, and it's amazing. Keep up the great work, Kelly Henriquez. Here's a clickable version of the link that is listed in the video. So they are thanking you for all the resources and all your work that you have shared. Perfect. And there, Kevin is sharing that link there. Thank you, Kevin. Thank you so much. I really like it when you guys interact and share this kind of resources with everyone that's watching. Yeah, that's really, really nice. Okay, so let's go to this topic that I find fascinating. I told Kelly at the beginning that I am very ignorant in it. I am fully supportive, but very ignorant. So I just know what I read, and that's it. I haven't had really too much interaction about the LGBTQ community within the interpreting field. And I wanted to talk about the intersectional trauma, the importance of LGBTQ affirming interpreting services. Tell us a little bit about this, Kelly, and let us know what is it? What are you talking about when you say this?
So first off, I wanted to say that I have a Facebook group called Career Friendly Interpreters and Translators.
Mhm.
And in that group, before I started that group, I thought I knew a lot of things. And it turns out I did not. I mean, I did, but I didn't. I've learned so much from this group. I love my group. Y'all are amazing. And I feel like I've come such a long way, but the thing is we're all works in progress. We're never a finished product. We're never reaching perfection. It's something we always strive towards. So I think it's excellent when someone can admit, hey, I don't know everything, because that means that you're allowing yourself room to grow. So kudos on you, Pamela.
Thank you.
Secondly, so what you mentioned, intersectional trauma, the importance of providing LGBTQ affirming interpreting services. So I am actually, this is my first year participating in the National Council on Interpreting in Healthcare's annual membership meeting. There's this thing they have called Language Access Cafe, which I have not been to before, but I will actually be leading a language access cafe section. And like I said, it's called Intersectional Trauma, the importance of providing LGBTQ affirming interpreting services. So, and the annual membership meeting is from April 8th to 10th, and their early bird registration ends on March 12th.
Tomorrow. So hurry up.
Yeah, so hurry up.
Yeah.
But so intersectional trauma. So we talk about trauma. This is what I hope to talk about. It's very much an informal kind of conversation session. And so there's this concept in really human services professions called trauma-informed care, which means that when you're providing services, you are conscious of the trauma that people are bringing to the table. Also, there's this concept of intersectionality, where you have these intersecting identities. You know, I'm not just white, I'm a woman. I'm French, Polish, British, Irish. I'm bisexual. I'm married. We have all these intersecting identities. Then within the LGBTQ population, so we have all these different letters that mean different things. So we have our LBGT, right? Q. We'll go ahead and use the fingers here. Mm-hmm. And then we also have LEPs, so folks who are limited English proficient. And so let's say we have someone who's Spanish speaking, someone who's deaf or hard of hearing. Those folks also use interpreters as well. So we have these two different things. We have our LGBTQs, and then we have our folks who use interpreters. So here we have two different intersecting identities, right? So when we have these folks coming into interpreting encounters, they're bringing with them these marginalized identities, oftentimes, in these cases, multiple layers of marginalized identities, meaning they likely bring with them a lot of trauma that come from being part of a marginalized community and multiple marginalized communities. So when we are interpreting for folks who have these multiple layers of marginalized identities and bring trauma to the situation, we have to be mindful of it. And in the instance of working with the LGBTQ population, it's really important to be affirming. And by affirming, I mean supportive. It doesn't matter whether you believe. It's very difficult for me to phrase this, but it doesn't matter whether you agree with someone's identity, because your job as an interpreter is to be impartial. So it's important that if the provider, let's say in a mental health encounter, is using gender affirming terms, like using the singular they, that you know how to interpret these terms. That way you're not further, and I know it sounds like a strong word, but you're not further traumatizing that patient. Because by denying that person's gender identity or their sexuality, what have you, or even saying things or interpreting things in such a way that are insensitive when the provider is not saying them that way, you're inflicting trauma upon that patient, which that's not something you're supposed to be bringing to the interpreting encounter. So it's kind of a discussion that we're going to have about that, about trauma. It's really dense. It's trauma-informed care, trauma, intersectionality, the LGBTQ community, and kind of intersecting identities they have, we know they're either going to be an LEP if we're interpreting for them, or they're going to be deaf or hard of hearing, which that community as well also experiences discrimination.
Oh, yes. Oh, yes. Well, because it doesn't matter. I mean, that is just one characteristic, right? It's not their whole definition as a human. So it's just one part of them. And yes, I totally understand. This is what I find hard. And maybe that's something that to look at in training, because you have to balance empathy with impartiality.
Mm-hmm.
And that can be hard to attain because many people confuse empathy by being partial, right? And so how do you put these two together?
So there's a difference. There's a fine line between empathy and advocacy, because I think what happens is a lot of folks carry so much empathy that they're unable to control it almost. And they just feel this overwhelming urge to step over that line where they're no longer being impartial.
Mm-hmm.
So I think in situations where I've had to interpret really difficult things that I don't agree with, because I've had to interpret. Pamela, have you had to interpret things that you don't agree with?
That's why I don't have a. Yes, no, it's just it's just the work. It's just a job. A lot of times, you have to remind yourself that as much, because you're a human and you have values and you have beliefs, but you also have to remind yourself that you are doing your passion probably, but it's a job at the end of the day, and you have to follow certain standards. But yeah, I totally understand that. So I'm sorry, I didn't mean to cut you off.
Oh no, you're fine. No, everything you just said is perfect. I totally agree with it. I guess I'm trying to think of, I had one instance where I had to interpret something very, very ugly, and I wanted to tie it into mental health. I had to interpret something very, very ugly that a patient in an inpatient psychiatric unit was saying to a nurse. And it was just so ugly and something that I just so disagreed with. And I had to interpret it. And in that moment, I had to remind myself, I am not saying these things. I am the messenger. And it's important for these things to be known in the context of mental health, because the nurse now knows that it's very clear that the patient is becoming agitated. It's very clear to the nurse that perhaps even if the patient is of sound mind, they might not like them. So that gives that nurse some information, some very valuable information as they go through and carry out their duties. Okay, perhaps I need to interact differently with this patient. Perhaps I need to write this down in the patient's chart, because who knows, this could be a symptom.
Right.
So sometimes interpreting these interactions that may seem very unpleasant to us are actually very purposeful. They serve a purpose. And also you have to trust in the autonomy of your patient, because that's one of the NCIHC's values. Their core values is to respect the autonomy of patients. And there's, again, a fine line between, coddling and advocating, because patients are autonomous human beings. You can't baby the patients that you're interpreting for. You have to give patients an opportunity to speak up for themselves, which for me is something that I feel very strongly about. I'm not sure if you've ever heard of white savior complex.
No, but I think that it's funny that you mentioned it. Please finish your idea. Yeah.
So it's something very common that happens with folks of a paler complexion, because as a white person, I have a fair amount of privilege, which is, a given. And sometimes you might feel the need to kind of dominate the conversation and advocate for someone else very aggressively, but that's not your place.
Right.
And you have to learn, okay, this isn't my place. And I'm going to let people take care of it themselves. And if they need me, they'll let me know. They'll give me some sort of signal or sign. They may not express it verbally, but I know when that is. So I think that's important.
I like what you're saying. I totally like what you're saying. I do disagree with that it's only a white people problem. I think a lot of people have it, and especially a lot of interpreters. I'm going to go ahead and say that because we believe that since we are the conduits,
Yes,
we have the power of deciding what is relevant and what is not, and that is totally against what we are supposed to be completely.
you are touching on something that I believe to the core of my being, which is we're interpreters, we're not gatekeepers.
Exactly.
We don't get to decide what's right and what's wrong. When we start placing value judgments on language, we're bringing partiality. We're not being impartial. So to say to someone, "Oh, the way you speak is incorrect," that's not your job.
Right.
And also, language is beautiful. There's so much variety. There's so much. I mean, Spanish regionalisms. I mean, come on.
Yes.
I'm sorry, Pamela. Where are you originally? Where's your?
I'm from Peru.
Oh, Peru.
Yeah.
Okay, I used to work with the Peruvian, the clinic I used to work at.
Nice.
So,
yeah.
La
No,
vaina,
and it is. I understand where you're coming from on that. Please let us know what you think about this as well. And Laura just shared another resource there. The RUHS has a great MBA MAB program. And she says that she feels really comfortable working at the mental health facility there. So yeah, that's good. And share, please, all of the questions that you may have about this topic. So I finally wanted to ask you about this. Has been, by the way, an amazing conversation. I really am learning a lot from you, and I thank you for that because, as I said, and I'm going to be honest, which I always try to be honest, and I don't.
That's a good thing.
I'm not trying to offend anyone, but when I thought about the LGBTQ in interpreting, I thought, well, I mean, is this really an issue? Like, is it really a topic? And now that you're pointing out all these facts, I go like, oh well, yeah, that totally makes sense because yes, as we know, many of you are probably either native or descendant from Latin Americans. So our culture in Latin America, because of the colonizers, is strongly based in religion and in dogmas and in rules, and we have to fit the mold, right? Otherwise we're just not worthy. And that's what I hear that you're telling me. They already come feeling like that, and I'm talking about the patients when I say they, that we would have to interpret for. And so if we go there as interpreters and we give this, we're not training soft skills, as you're saying, we are going to put one more layer of shame on them, which is going to be super counterproductive. It's going to make our work harder. The conversation is not going to flow as we expect. Could you expand on the acronym? Oh, yes. I think, Laura, that's for you. If you can share with us RUHS. Nanyi cannot find it online. But yeah, I understand that. And so I thank you for expanding my mind on that. I didn't see it from that point of view. But yeah, thank you for that. So now, anyone that may want to join your LGBTQ group on Facebook can go to this Facebook page, and it's a private group, right?
It is a private group, and it's very important to answer the membership questions, because if you don't answer all the membership questions, I will eventually message you and ask you how you feel about the membership questions, because we really want it to be, I not just have interpreters and translators in this group. I also have folks who are just members of the LGBTQ community who are really, they want to help. They're open to sharing information. I share information all the time about what it means to be bisexual because a lot of people feel that there are certain letters in the alphabet that are a little bit more difficult to understand, and they think, "Oh, I got this. I understand what bisexual means." A lot of people don't. So there's a lot of education that needs to be going on, and a lot of conversations that need to be had. And I really love the group environment because if you make a mistake, it's okay. No one's going to shame you. I even point out when I make mistakes. I'll even share it in a post and say, "Hey, I thought this thing and I was completely wrong." Just to show some vulnerability and let people know, like, hey, it's okay to be wrong. The important thing is that you're willing to learn and you're willing to better yourself and be more of an ally to the community.
Yeah, I love that. Yeah, I really like that. The fact that you're spreading that making mistakes is it's all right, especially for the interpreting community, because we are very hard on ourselves.
Don't even get me started about all the mistakes I used to
Right?
make.
I think everyone has something to say about that. Absolutely. Ooh. And this is what she meant. It's Riverside University Health Systems.
I wrote it down.
Thank you so much, Laura. I really thank you for that resource. So let's talk about your trainings before we run out of time, because you have quite a few that we need to share. One of them is the advocacy resources that we already shared, and I'm gonna paste this in the comments, so any of you that are interested can go and check this out. And by the way, before you answer and tell us about this, I do want to remind you that we have a YouTube channel where you can go and subscribe. And if you prefer to watch us from YouTube and you don't have a Facebook, you can go ahead and comment, and we still get the comments. So I got that question a couple of times last week. So go ahead and join us on YouTube, subscribe so we can grow, share the videos and all that. And thank you so much for following us. Okay, now let's talk about your trainings, Kelly.
Yes, so we have that page where where you post mental health advocacy resources. So that's going to have the series of trainings that I'm doing that are available, for free on Americans Against Language Barriers. Then we have I think I'm starting to get the hiccups here at the end.
Oh, that's okay.
And then we have the self-care resources, which is just a collection of self-care resources, including the interpreter and translator peer support group, which again, you have to answer all the membership questions on that as well. And then I had mentioned the National Council on Interpreting in Healthcare. They have their annual membership meeting coming up, and I will be leading a conversation at the Language Access Cafe about intersectional trauma, the importance of providing LGBTQ affirming interpreting services.
Mm-hmm.
Yes. And that's their LGBTQIA resources page. But if you go on the on the NCIHC's main page, you will see they have everything about the upcoming AMM, which is on April 8th through 10th. And the early bird discount for registration ends tomorrow, which you just informed me of.
Seriously, yeah, hurry up. And you know what? Another thing is, even if you don't belong to the LGBTQ community, I think it's a great opportunity to learn about it.
Oh, yeah. And that it's not just for folks who are a member of the LGBTQ community. You can be an interpreter or translator. The group is called Queer Friendly Interpreters and Translators, which means that you just have to be someone who believes we're human beings and deserve the same rights as everyone else. That's basically all it is.
That's basically it. Yes, I love that. So we have just 1 minute. I want to thank you, Kelly, so much for being here. I really appreciate you accepting the invitation. You have my respect and the respect of many here. I am really happy to see that you're helping so many others. Props to you on your language skills. Apparently, again, Ernesto thinks that it's.
Thank you, Ernesto.
Yes. I think that it's also because of the trainings that you have given. So, and I have been very focused on taking my exam, so I haven't really expanded too much out of there, but I just spilled the beans. I said I wasn't going to say anything.
I didn't say anything, though.
Right.
Well, thank you so much for having me, Pamela. I know we don't have much time left, but I really appreciate you having me, and thank you so much again.
No, you're welcome. Please keep us posted whenever you present a new training. If you think you need us to share any information about any of this, please let us know. And we hope to have you again in the Linguist Radio soon. I don't know, in the future, probably, when things start,
Things start to normalize.
rolling. Yeah, yeah. Thank you, everyone. Thank you, linguists, for watching. And let us know if you have any other comments. Who would you like to watch? Who would you like me to invite? Because I have some guests in mind, so I would really appreciate some help there. Take care and see you next week. Bye.